I think that's everybody. Thanks, everybody, for, as you can see, we have a good cross-section of our area, our region, and hopefully some good ideas come from that. Our presenters today, Charlie Wilcox is going to speak pretty much on the history and current operations of what's going on with Vitalant. Dr. Kiss is going to talk about the blood donation process and actually what needs to occur before the blood can be transfused into a person. And as Dr. Triolzi is going to talk about the transfusion medicine practices and safety that we go through, Vitalant goes through every day. And lastly, as I said, the Forbes Fund is going to facilitate this at the end of this meeting in the next 2 sessions. And we're going to try to do all this in 90 minutes. So please start eating. Don't wait. We're going to while the presentations are happening, the food's going to get served. That's why we took your orders whenever you came in the door. So we're going to try to be as efficient as we possibly can. Lastly, well, again, I talked about I'm the president and CFO of the Blood Science Foundation. Well, what is the Blood Science Foundation? Simply put, we are the fundraising arm for Vitalant. We're tax exempt, and what you're going to hear today takes a lot of operating dollars out of Vitalant to make sure that the world-renowned healthcare that we provide in this city occurs. My job is to make the operations of Vitalant, make sure that the programs that they've been doing for so many years continue. So much money is used to make sure that the blood is here where it needs to be here, in the quantities that it needs to be here, that programs are at risk, our scholarship program, a number of programs. My job is to fundraise to help support that operations. The blood industry is also very capital needy. My job is to help fund some of those capital needs. And lastly, Vitalant has an enormous research institute. They do research in both blood diseases, transfusion practices, and safety. And our job at the Blood Science Foundation is to help continue that funding for those. Now, we just started doing fundraising in 2017. Prior to that, everybody thought there wasn't a need. Because we asked people to stick their arm out and put a needle into it and donate blood, you can't ask people to donate money. And so what we're trying to do is tell this story, and this is just one way of telling the story. So before I turn this over to Charlie, some goals for this series. There's a number of them, but the 2 big ones is to develop a long-term strategies that will increase local blood donations to Vitalant, especially among minority and younger citizens. And secondly, to develop strategies to create and maintain new community partners. So those are the 2 overriding strategies that we're hoping to deal with here tonight and the next 2 sessions. So with that, I'm going to turn it over to Charlie Wilcox. Charlie, it's all yours.
First of all, thank you all for coming this evening and sharing your time and your expertise. We know how much both your time and your expertise are worth, so thank you. We're going to describe to you this evening something that we believe is rapidly becoming a community healthcare crisis here in the Pittsburgh area, that we as a community must figure out how to resolve. And as community leaders, we appreciate your help in helping us think through how to tackle this problem before it becomes even greater. Now, I'm going to begin with just a little bit of general background, but I very quickly am going to get on to the key issues at hand. But starting with background, just to say, we are Vitalant. Now, many of you here may not know us as Vitalant. You might remember us as Central Blood Bank or Institute for Transfusion Medicine, but we're the same good mission, same good people, just a different name. We are our community's blood supplier and have been for over 50 years. Again, same good mission, just a different name. Now I'm catching up with slides. There we go. Again, a bit of history. Central Blood Bank began here in Pittsburgh in 1952 as Pittsburgh's Blood Center. It later branched into providing transfusion services to hospitals and a comprehensive hemophilia care center to serve area hemophiliacs under the broader umbrella of the Institute for Transfusion Medicine. Central Blood Bank and ITXM joined Vitalant then in 2017 during a period of industry consolidations. And a lot of us in our businesses saw that, where a lot of independent small operations needed to merge with a bigger entity to get economies of scale and more efficiencies. That happened in healthcare. You saw a lot of hospitals join together. It happened in blood banking. You saw a lot of blood centers come together. So again, as Central Blood Bank and ITXM looked for a partner, they chose Vitalant as that larger national partner. Vitalant started in 1943 as the Salt River Blood Bank in Phoenix, Arizona, and has come a long ways since then. Currently, Vitalant is the nation's second largest blood provider, collecting over 1.9 million units of blood annually, serving 900 hospitals in 28 states throughout the country. And there's a quick map that shows our divisions and coverage areas. This shows our divisions. Obviously here, we're what's called the Northeast Division. It is headquartered here in Pittsburgh, so we're home right here. We also manage blood centers in the Northeast Division in Chicago, in New Jersey, in Cleveland, and then here in Pittsburgh, and I have the privilege of managing this division. Now, from a national perspective, I thought you might want a quick look at blood banking nationally. In the United States, we transfuse over 10 million units of blood per year. The American Red Cross is our nation's largest blood provider. Vitalant is the second largest. And again, a bit of history. Blood banking as we know it basically started after World War II. Basically, physicians returned home to their hometowns after the war effort, and they had really had a lot of obvious experience during the war of treating trauma victims with blood products. And I think the physicians returned to their hometown, said, hey, we really had some good success with blood transfusions. We need a local blood center. So literally throughout the country, just spontaneously, local communities started blood centers. And it almost was a matter back then of whoever put their hand in the air first. I know in Kansas City, Missouri, the Chamber of Commerce said, we're the Chamber of Commerce, we'll start the blood center. In Austin, Texas, the County Medical Society said, gee, we're the County Medical Society, we'll start it. In Dallas, Parkland Hospital said, we're the big user, we'll start it. In some communities, the local Red Cross chapter said, gee, that fits our mission well, we'll start it. In other communities, private entrepreneurs started it. It literally began that hodgepodge in the beginning. Obviously, here in the Pittsburgh area, a group of physicians and doctors started what's now known, what we knew as Central Blood Bank. So when people ask me, for example, why does the American Red Cross provide the blood supply in Philadelphia, and why does Vitalant do it in Pittsburgh? Well, it just kind of goes back to who put their paw in the air first way back when. I wish I could give you a more scientific answer than that, but that's how it evolved, and evolved to the point it is now. So locally, Vitalant Pittsburgh is our community's blood supplier, providing blood to the 50 hospitals in our community, the greater Pittsburgh area, including all the Allegheny Health and UPMC hospitals. These 50 hospitals transfuse an average of 600 units of blood per day. Now, that's kind of a staggering number, and most anybody I've ever talked to is stunned by that number. Literally 600 blood transfusions happening per day in this community. So that means we need to have 600 volunteer blood donors rolling up their sleeve and donating blood on an average day in this community, donating blood before it's needed. And the sad fact is we're not seeing that needed 600 blood donors per day, and that's why we're here today talking about it. Some of you may have seen this particular graphic before. Our donor base in this community has alarmingly declined by more than 50% over the 10-year span depicted there. You'll notice in 2007, we had just under 90,000 blood donors. In 2017, just under 45,000. In 2007, they donated 154,000 units of blood. In 2017, just under 80,000. That's literally a 50% decline in 10 years. Now, since then, In 2018, many of you may know, some of you are involved, we started a very aggressive donor-based revitalization campaign here in Pittsburgh. And we really made a lot of noise and worked real hard at being visible in the community, telling our story. And I want to tell you, we had some very good initial success. We literally turned it around from 10 years of a 5% a year decline to 6% up, a 6% increase in 2019. We all felt we had some traction. We were getting excited, and then COVID hit. Early 2020, COVID hit, and the bottom dropped out again. And that's obviously where we are now. So you might ask, since we haven't been collecting enough blood locally to meet our community blood needs, what have we been doing? Where's the blood been coming from? And the tough news is we've been importing nearly half of our community's blood supply for a number of years now from other cities who are able to overcollect. And yes, fortunately, we have the Fargo, North Dakotas, and places, particularly usually in the Midwest, usually more rural, that are actually able to recruit more blood donors than they need, and they will share that. So we literally have depended on other cities to overcollect to meet our needs. Now, financially, that has a pretty hefty price tag. We're spending about $10 million a year right now importing blood in from other cities, and that's obviously a healthcare cost strain. But the cost isn't the real issue. More importantly, there are times, frequently in the summer, frequently around holidays, when even the Fargo, North Dakotas don't have anything to share. Because they're struggling too. They're facing some of these same, maybe not as severe as we have, but they're facing some of these same shrinking donor-based challenges. So they're having more difficulty sharing. So what happens when we can't collect it and when we can't import it? That's when we begin putting our community's health care at risk. And that's the issue we're talking here about today. I can't resist, when I'm having this discussion, I can't resist putting this slide up. For those of you in the back of the room, you'll notice the slide is on a decreasing trend there. And the gentleman says, at this point in my report, I'll ask all of you to follow me directly to the conference room below us. That's how I feel sometimes when I'm talking about our donor base right now, and we've got to turn it around. So what happens if we don't have enough blood? Well, quite frankly, physicians may be forced to make decisions and tough choices. They may have to ration what they have. They may have to consider postponing elective surgeries in lieu of emergency surgeries. But I'm not the one to talk about that. You're going to hear from Dr. Trolsey and Dr. Kiss later on, and they're better ones to talk about that than I am. So I couldn't resist putting this slide up also. Obviously, this is a shortage of the blood supply is causing stress for our healthcare system. And obviously here in Pittsburgh, we take great pride in our local healthcare system, and it's not something we want to stress. So the obvious question probably all of you are asking is, so where did these donors go? Why is the donor base declining? Well, you know, I wish there was one answer. It's kind of a death by a thousand cuts kind of a discussion. There's many different reasons. Let me talk about a couple. One, of course, is obvious. That's the aging population. For decades, initially our nation's blood supply was rested on what we refer to as the greatest generation, the people that began donating blood during World War II with that hard war-related ethic and donated blood through the Korean War. Obviously that generation aged, but fortunately they passed that ethic on to the baby boomers. And the baby boomers have been the backbone of our nation's blood supply for the last 4 decades now. But I can say this, I'm a baby boomer. We're now moving from blood donors to blood users. And that's the hard reality. And we've not been as successful in bringing along the next generations of blood donors. We've struggled with that, and we haven't found that answer yet. Again, another reason why we're having discussions like what we're having here today. So one issue certainly is the aging population has decreased our donor base. Another interesting one that's kind of a two-edged sword is in our quest for the safest blood supply humanly possible, we are in fact very cautious about who we allow to donate blood. I'll give you 2 very simplistic examples. We defer people who have visited malarial zones out of fear they're bringing malaria back. So we'll defer them, for example, for a certain period of time. I think the deferral's 3 months now, I believe. But the point is that knocks them out of the donor base. Another simple example, we'll defer people who've had tattoos from unlicensed tattoo parlors out of fear they might have contracted hepatitis and the transaction. Again, that's only for a number of months, but again, look around you and see how many tattoos there are. It's good in that it's in the name of safety, but it has an effect of shrinking the donor base. And the good doctors will talk later about probably other better examples. Another reason for the shrinking donor base is historically we've relied on businesses and industry to sponsor blood drives. Well, as businesses and industries get more efficient and downsize, as they move more to automation, as they move more to people working from home, that shrinks those blood drives. And the fact is, we live in a very busy, transient society with a lot of background noise, which also masks the message. And of course, we just got the plain issue of apathy. So again, a lot of reasons why the shrinking donor base, but the net effect is what we're talking about today. Now, I'm often asked, why don't more people donate blood? Well, a number of years ago, the Massachusetts Institute of Technology did a pretty comprehensive study on blood donor motivation. And after a whole lot of work, they came back with two prime reasons why people don't donate blood. One was, no one ever asked me, and two was, it's not convenient. Now, as a career blood banker, that just made me nuts. What do you mean no one ever asked you? What's what I do 24 hours a day. What do you mean nobody ever asked you? Your posters, billboards, commercials, PSAs. What do you mean nobody ever asked you? And what do you mean it's not convenient? Here just in greater Pittsburgh, we have 10 brick and mortar donor centers. We send out another 5 or 6 mobile blood mobiles per day. We're drawing blood in 15 or 16 locations every day here in greater Pittsburgh. What do you mean it's not convenient? Well, of course, finally then it sinks in. Donating blood is a very personal act. It's a big, ugly needle in my arm, and when it's coming at you, it looks like a big, ugly needle, right? It's a needle in my arm. It's something I'm nervous about. It's a personal act, and as a personal act, it requires a personal ask or a personal connection. Those posters, those billboards, those public service announcements, they're nice, and they help create awareness, but they don't necessarily motivate people to actually go in and donate blood. Donating blood often requires a personal ask or a personal connection. What do I mean by personal ask? It could be as simple as a coworker, the person that sits next to you in church, or a classmate saying, hey, Charlie, come on, I'm going down to donate blood. It's not that bad. Come with me. Or it could be as simple as one of those people saying, hey, I don't know if you know this, Charlie, but I'm alive today because of a blood transfusion. Come on, let's go. Okay, or a personal connection of a loved one actually using blood. Somehow it seems to need to be personalized to actually motivate to the act of donating blood, and that's one of our challenges. And as far as the issue of convenience, we've quickly learned that even though we draw blood in 16 locations a day, when I talk about convenience, I'm talking about my work, my school, my church, my apartment complex. That's what convenience seems to mean. And those weren't easy things to hear, but that seems to be the bottom line of what that study's telling us. So the next subject, I often hear people say, I'll give blood if there's a disaster. Well, that's nice, and thank you, but the fact is, blood must be donated before it's needed. It takes at least 2 to 3 days to appropriately test a unit of blood and prepare that blood for transfusion. So the blood that actually saved those disaster victims' lives was donated 2 or 3 days prior to the disaster when there wasn't an inkling that the disaster was coming. So what's this message? The message is we've got to have regular blood donors every day to be prepared for the disaster. Now, it's nice that people come in after the disaster to replenish the blood supply. Of course, that helps. But that's not the blood that saved those lives, and that's a tough message also. Another question I get asked quite often. Some people ask why they can't get paid for donating blood like they do for donating plasma. And the answer has to do with safety. And all volunteer blood supply is considered safety, because we still rely in part on the honesty of the donor during the donor screening process. So let me talk about that a minute. The Food and Drug Administration, I think back around 1980, brought in something called the National Blood Act. And they discovered, the fear is that if someone needs money bad enough, they might not be completely open about their health history during the medical screening process. And we still, again, rely a good deal on the honesty and the openness of people. Yes, I did travel to a malarial zone, or yes, I did do that, or yes, I did do that. Now, someone says, well, then why can the plasma industry pay? Different story. When the plasma industry collects plasma, they're collecting it to be manufactured into a pharmaceutical or a cosmetic. And their manufacturing process will kill any bad things in the blood. So they're kind of covered on that. We, on the other hand, collect the blood from a volunteer blood donor. We then, certainly we test the blood, but basically take that very unit of blood then and hang it in a hospital bed or a hospital over a patient. There isn't that other step in there, so we still depend on the honesty and the well-intentions of the blood donor. So that's a long explanation, but I think the question comes up so often, I think I need to spend a minute or two on it. Two very different subjects. But though we can't pay donors in this country, we can and do provide thank you gifts, such as Pirates tickets or Kennywood tickets or T-shirts, to say thank you for their life-saving contribution. But the rule is it's got to be minimus in value. The FDA says what we give the donor as a thank you can't be big enough that might cause them to be untruthful during the medical history process. I guess the general feeling is T-shirts, you're not going to lie for a T-shirt. Hope not anyway, right? So donor recruitment, key messaging, just kind of a recap of what I've been saying. First of all, there is no artificial substitute for blood. We can put people on the moon, but we've not found anything that does the miraculous things blood does in our body. So it's got to come from volunteer blood donors. You and me and our friends and neighbors rolling up their sleeves. In the greater Pittsburgh area, we need 600 blood donors a day. Blood must be donated so it's available before it's needed, at least 2 days before. Blood has a short shelf life. Blood has a 42-day shelf life, so you can't, after disaster, collect 10,000 units of blood and then use it for the next 4 months. You have a finite lifespan, so you don't want to under-collect, but you don't want to over-collect, because if you over-collect, you might waste it. And our challenge, I guess, is to convey to our blood donors the pride and self-satisfaction and sense of awe of actually saving a life. When you think about it, how many ways can you literally save a life? Well, I guess, you could pull somebody out of a burning building, you could save a drowning victim, but what are the odds? I would contend to you that a blood donor is literally just that vividly saving lives and at their own schedule and without harm to themselves. I would suggest to you that's the message somehow that we are challenged to try to convey. A bottom line is we need more people stepping up and donating blood on a regular basis before it's needed. We need to personally ask people and bring the need home. We need to make it convenient, so we need more businesses, churches, schools, and civic groups stepping up and sponsoring blood drives on a regular basis in a sustained effort. And I got to say, not just hanging posters. Quite frankly, if a business says, sure, you can set up in our room and we'll put up some posters, it's not worth our time. If there's not somebody personally asking and personally motivating and personally educating donors, very few people, it's not an impulse buy, very few people just walk in to donate. There's got to be some effort put into it. I've asked frequently lately about the COVID impact. Obviously, there has been a massive COVID impact. Obviously, all those businesses, churches, and schools that used to sponsor blood drives, obviously, they've had trouble doing that for the last 18 months. Now, I guess the other side of the coin, kind of the good news, bad news, is the hospitals have been so overwhelmed with COVID patients. In many cases, they've had to back down their elective surgeries, so they didn't use quite as much blood during this time period. But at some point, this thing is going to end, and we are going to go back to using to full elective surgeries and using full blood, and we got to make sure the blood donors come back at that same time, because the fact is, it's still needed. Obviously, blood donation was declared an essential function during the shutdown. And bottom line again, blood needs are ongoing and continue during COVID and certainly post-COVID, and we've got to be ready for it. And again, folks, that's why we've brought this good brain trust in the room to help us kind of think through how are we going to handle this challenge moving forward. And thank you for your time. And with this, I get to hand it to Dr. Kiss. Thank you.